and this lecture is going to address infections that can affect pregnancy outcomes. So we refer to many of these infectious diseases as the torch viruses. So the T for toxoplasmosis, O is for other, and included in this is syphilis, varicella, parvovirus, B19, it's not supposed to be B10, so correct that, B19, enteroviruses, and HIV. Rubella, cytomegalovirus, that's abbreviated CMV, and herpes, known as HSV. So what's the big deal with these infections? Well, they can cause significant morbidity and mortality. They can cause permanent hearing loss. You're going to see as we proceed in the lecture some of the rashes that these babies have. They can be born with thrombocytopenia, hepatosplenomegaly. They can have conjunctivitis, microcephaly, and this is the way they're going to remain. They can also develop intracranial calcifications, and last but not least, it can lead to death of the fetus. We're going to begin with toxoplasmosis. So what this is a cyst-type illness that's transmitted fecal-oral route. Mom touches, puts it, doesn't wash her hands, puts it in her mouth, and it will go through the placenta. So if you pause the video and you look closely, you can see what the cycle is of transmission of the toxoplasmosis. So cat feces are implicated, undercooked meat, goat milk that has not been pasteurized, as well as contaminated soil or water. So a pregnant woman who is playing around in the garden and isn't wearing gloves could be at risk, especially if there are rodents or cats that frequent the yard and they use that dirt as their toilet. First trimester exposure to toxoplasmosis can lead to death of the fetus. Second trimester, you won't have death, but you have hydrocephalus. You can get those calcifications intracranially, and the fetus can have chorioretinitis. And then once the baby is born, what we're looking for, and you will probably see, is a microcephalic baby who has been intrauterine growth restricted. The baby might start having seizures, maybe not right in delivery, but at some point in the nursery or when the baby is out with the mother in postpartum. There can be hearing loss, they can have a rash, anemia, hepatosplenomegaly, as well as lymphadenopathy. So the important teaching points with toxoplasmosis is if this woman is to garden, she needs to wear gloves. If she's working or if she has cats, it's recommended that someone else change the litter box, clean it out. Now, the transmission of these oocysts in cat feces usually will break apart within 1 to 2 days. And so the cat litter needs to be cleaned every single day. Now, if this pregnant woman does not have a significant other, then she needs to wear gloves while she cleans the litter box, and then make sure that she washes her hands. Now, syphilis, you have another video to watch called Congenital Syphilis, and that is by the Khan Academy. So make sure that you watch that. It's caused by the Treponema pallidum, and you're going to hear more about syphilis later on in the course. So we are drawing an RPR or a VDRL. Both of these are screening tests for syphilis. Now, if it comes back positive, then we need to have the patient come back, and we're going to draw another sample of blood and send that off for the FTA ABS. If that's positive, we definitely have an active syphilis on board, and we're going to treat it with the penicillin. So this is acquired through sexual activity, and then it is transmitted through the placenta to the baby. So this baby also has a number of defects, including sensory neural hearing loss. And you see the picture. They have problems with their dentition, and when you look at that baby, that does not look normal. So we screen them, we treat them, and then we hope and pray that this baby does not develop congenital syphilis. Let's move on to rubella. When is the last time you heard of a rubella case? Well, when was the last time that you heard of a measles case? Until last winter when we had an epidemic. So the bottom line about rubella is let's immunize, immunize, immunize these patients. If the mother acquires rubella, it's through the respiratory secretions, and then this does go through the placenta. The fetal effects are lifelong. Believe it or not, I had a child that I cared for who had congenital rubella syndrome. And he was a beautiful, beautiful child. But he was deaf, he was blind, he was severely mentally impaired, he had a small head, beautiful head of hair though, and his mother really didn't want him. So we took care of him the majority of his life until he died, and he died less than 2 years of age. When you look at this picture, this is an example of the blueberry muffin lesions that this baby is born with. So there may be congenital cataracts. So those of you going to mission when you have to use the ophthalmoscope to check for the red reflex, you're not going to get that in a baby who has congenital cataracts. Now mind you, congenital cataracts can come from things other than rubella. They may also have congenital heart defects, and they'll have hepatosplenomegaly. So immunize, immunize, immunize. And remember, this is one of the blood tests that we draw on all pregnant women at the first prenatal visit. If it's negative, she stays away from anyone with a rashy illness throughout the pregnancy.